Wait. Hi, my name is Christina Pisacreta, and I am in Dr. Levy's Introduction to Special Ed 602S course. Today I will be talking about the use of assistive technology in the classroom. This presentation will provide information for teachers to use in order to effectively use language in the classroom in order to improve both receptive skills and expressive. How many children have communication disorders? The overall estimate for speech and language disorders is widely agreed to be 5% of the school-age children. This figure includes voice disorders at 3% and stuttering at 1%. The incidences of elementary school children who exhibit delayed phonological articulation and developmental is 2 to 3%, although the percentage decreases steadily with age. The second communication disorder is hearing impairments. Estimates of hearing impairments vary considerably, with one widely expected figure of 5% representing the portion of school-age children with hearing levels outside of the normal range. Of this number, 10 to 20% require some type of special education. Approximately 1/3 of students who are deaf attend residential schools. 2/3 attend day programs in schools for students who are deaf or day classes located in regular schools. The remainder are mainstreamed into regular school programs. I found this information to be extremely valuable. I am a preschool teacher who teaches in a 12 to 1 to 2 setting with majority of my children who suffer from some type of speech and language disorder. I actually have one student in my class with a hearing impairment. Many people that I have come across have said that they hardly see a child who has any hearing impairments. However, with these statistics that show such a high percentage, it is possible that you may run across a child who has a hearing impairment. The child in my class is deaf in one ear, and I am required to use an FM unit. The question is, who will need assistive technology in the classroom? Children that struggle to be understood will benefit by using assistive technology. The following are a list of reasons that may indicate the need for augmenting or supplementing a youngster's verbal communication. A child diagnosed with autism, Down syndrome, or any other developmental disability. A child that has a severe form of communication disorder. Child that is hearing impaired. Cognitive and or motor skills that are developmentally significantly delayed. A child cannot effectively communicate needs and wants and becomes frustrated. Parents, teachers, or adults working with the child and finds it hard to understand them. A child cannot effectively communicate his needs and wants and becomes frustrated. A child has stopped trying to communicate verbally. The following are slides of assistive technology that I use in my classroom. Sign language can be a full language such as American Sign Language, or it can be simple gestures and cues. Each of these should be accompanied by attempts at verbal language with verbal repetition by persons on the receiving end of sign messages. This is a chart that I have displayed in my classroom for my students to use as well as my teachers' assistants. This is the alphabet in American Sign Language from A to Z. I use this to communicate with some of my children who have a difficulty with understanding language and speaking. Not only when I use this sign language do I only use gestures, however, I allow the children to verbally hear the word and request that they repeat. When a child is requesting that they need something or want more, they indicate with using their hands. However, before I give them what they want, I will request for them to say, "More please," and they will do it. I also use American Sign Language to incorporate it with music. A lot of my children enjoy music and singing songs. However, some students who are unable to speak, or the child that I have that is selective mute, I try to make songs and use the American Sign Language along with it so the children could all participate in the songs. The next is something that I use a lot in my classroom. This is a communication board. Communication boards are easy to use for both the special needs child and the communication partner. Symbols are simple to interpret and may include drawn pictures, letters, and photos of items desired or needed. As you can see here, this is a communication device. It's a communication board. Over here is what is inserted inside the device. A child usually uses this throughout the day, and they will press on the picture that they want to indicate what they need. If you take a look over here, this is a piece that belongs inside the communication device. This is one of my students in my class. I use several different one of these because each poster will indicate different things. This is something with everyday items. The child will press the button and the communication board will verbalize what the child wants. So for example, if the child is requesting they want milk, they will press it milk and then the machine will speak for them. I find the communication board to be very useful because the child is not only visually seeing what they want, but they're also hearing it. So some of them will then repeat when they hear it coming out of the communication device. This is given to my student usually from the speech pathologist. It is only assigned to the child if they have a severe language disorder. Also, each slide will indicate instructions for the substitute teacher that's in the room or any other person that is working with the child and is not familiar with using communication board. These slides are made usually by the speech pathologist, and I happen to work with the speech pathologist because I find that sometimes these boards do not always help. When I'm teaching a certain lesson, for example, we did a unit on butterflies and we talked about the life cycle of the butterfly. We didn't have anything to help indicate or verbalize. So what we did was we created our own board, and we had one of the speech pathologists record themselves on the communication device so the child could hear what they needed to hear. So sometimes it's important that the person that uses the communication device requests different types of posters to insert into the communication board. However, the slides that you are given are very useful because they do indicate things a child does need every day. The next thing is what I did in my classroom to help children with children with learning with language problems is creating a language-enriched environment. A language-enriched environment will include both words, printed, and pictures to help the child understand. This is an example here of some things I have posted around my classroom. For example, you see a chair with the picture of the chair. So if I tell the child, go to your chair, I will indicate here, the child will use the picture to help them as a visual aid, and the child is able to understand. Another thing that I do in my classroom is I have all my centers labeled around my room. This is an example of some visual aids that I use in my classroom or language-enriched environment. This is my art center. This is hung in my art center, and when the child is asked, where would you like to go in center time, they have a smaller version of this, and they can go up to this poster and put their name here to indicate what they want. This is the art center, as well as if a child wants to go to the reading center. So these, I have multiple copies around in my classroom, and I will say, okay, boys and girls, it's time for everyone to go to the reading center. And look at the reading center, there are books. So the child knows just by looking at this that, oh, okay, now I have to go to the reading center. I found that the language-enriched environment not only helps my children that have language problems, however, it does help some of my children that are ESL learners. That means that English is not their first language. Majority of my children come from a Spanish background and they are learning English. So having pictures displayed with written words is very, very useful for all my students in my room. Another thing that I found to be useful is picture schedules around my classroom. It can help children if you post a daily schedule in picture formats as well as written format. This is an example of picture format along with written format. This can help very young children, children with communication disabilities, children for whom our English is not a first language. One thing that I think that is important to understand is that picture schedules displayed around the room does not disrupt or disturb children in any way. So this can be very simple, making your day easier and reducing your stress on your child with special needs. One thing when I started to teach without this assistive technology, I found that my days were extremely stressful because some of my children were getting extremely frustrated because they were unable to verbally say what they needed or request information that they needed help with something, and I couldn't help them, my assistants couldn't help them. So I did a lot of research. I came across all 3 things that I found to help me throughout the year, and I have to say that a lot of my children are grasping to the assistive technology. Again, not all of them use it. Some of them are able to verbalize themselves. However, the 2 that I find that are most useful in my classroom is a language-enriched environment and sign language. Something like the communication device, communication boards, are usually given to you by a speech pathologist. I hope that I gave you some valuable information today on assistive technology. I know that it has helped me, and thank you.